What if the signs of just getting older or being stressed out are actually your body whispering a serious warning? For years, the subtle symptoms of diabetes can be dangerously easy to dismiss. You might feel a bit more tired, a little thirstier, or maybe your vision seems just a bit off. It's easy to blame these things on a bad night's sleep, a stressful week, or just another birthday. But what if it's more? Today, we're pulling back the curtain on the stealthy signs you might be ignoring, and what they're really telling you. The silent problem diabetes is a condition where your body either can't produce enough insulin or can't properly use the insulin it makes. Think of insulin as the key that unlocks your cells to let sugar, or glucose, from your food in for energy. When that system fails, sugar builds up in your blood. Over time, this can seriously damage your nerves, blood vessels, eyes, and kidneys. There are two main types. Type 1 is an autoimmune disease where the body attacks its own insulin-producing cells, and symptoms often hit fast and hard, especially in kids and young adults. But type 2 diabetes, which makes up about 90 to 95% of all cases, is much sneakier. Its symptoms develop so slowly that millions of people have no idea they have it. They just go about their lives, completely unaware of the damage quietly building up inside. Ignoring these whispers can be devastating. Untreated diabetes is a leading cause of blindness, kidney failure, heart attacks, strokes, and lower limb amputations. The longer it goes undiagnosed, the higher the risk of these life-altering complications. That's why recognizing the earliest, most subtle signs isn't just helpful, it's critical. Think of this as a guide to learning your body's secret language so you can catch the warnings before they become screams. Section 1. The classic signs you might be dismissing. Let's start with the big ones, the symptoms you've probably heard of, but are so easy to write off in day-to-day life. First up, increased thirst and frequent urination. This isn't just feeling parched on a hot day. This is a deep, nagging thirst that a glass of water can't seem to fix. At the same time, you might feel like you're living in the bathroom. When there's too much sugar in your blood, your kidneys go into overdrive to flush it out, taking fluids from your tissues along with it. This starts a vicious cycle. You pee more, which dehydrates you, which makes you incredibly thirsty. So you drink more, and then you pee even more. While peeing 4 to 7 times a day is normal, if you're going way more often, especially waking up at night, that's a huge red flag. Next, we have unexplained weight loss. And I know what you're thinking. Losing weight without trying? Sounds like a dream. But this is the kind of weight loss you don't want. If you're eating normally, or even more than usual, but the pounds are still melting away, your body is sending out an SOS. When your cells can't get glucose for energy, your body thinks it's starving and starts burning fat and muscle for fuel instead. So while you feel hungry all the time, your body is essentially cannibalizing itself for energy. That brings us to extreme hunger, also known as polyphagia. This isn't just getting the munchies. It's a profound hunger that sticks around even after a full meal. Your cells are starved for the glucose they can't access, so they're screaming at your brain to send more fuel. You eat, but because the energy can't get where it needs to go, you feel just as hungry as before. Finally, in this group is overwhelming fatigue. This is more than being tired. It's a bone-deep exhaustion that makes simple tasks feel impossible. With your body's main fuel source, glucose, stuck in your blood, your cells are running on empty. Combine that with dehydration from all the extra trips to the bathroom, and you're left feeling constantly drained. You might even feel most exhausted right after a meal, which is when your body is struggling the most to handle all that sugar. Section 2. The sneaky symptoms affecting your senses and skin. Now let's get into the stealthier signs, the ones that are even easier to blame on something else. Have you noticed your vision blurring? You might think you just need new glasses, but vision that fluctuates can be a telltale sign of high blood sugar. High glucose pulls fluid from your body's tissues, including the lenses of your eyes. This makes them swell, changing their shape, and messing with your ability to focus. Your vision might be clear 1 hour and blurry the next. If ignored, this can lead to serious eye damage like diabetic retinopathy, a leading cause of blindness in adults. What about slow-healing sores and frequent infections? That paper cut that just won't go away, or a string of colds you can't seem to shake, might be a clue. High blood sugar weakens your immune system and damages circulation, especially to your hands and feet, which slows down the healing process. For women, this often shows up as frequent vaginal yeast infections, or UTIs, because the extra sugar in your urine creates a perfect breeding ground for bacteria and yeast. Then, there's that pins and needles sensation, tingling, pain, or numbness in your hands or feet. This feeling is a sign of nerve damage called neuropathy. While it's often a long-term complication, it can be an early symptom for some. Persistently, high blood sugar is toxic to delicate nerve fibers, and you might notice it as a burning, tingling, or numbness in your fingers and toes. And finally, a very visible but often misunderstood sign: dark patches of skin. If you've seen dark, velvety patches that look like a smudge of dirt in the creases of your neck, armpits, or groin, you're not just seeing things. This is a condition called acanthosis nigricans, and it's a strong signal of insulin resistance. Those high insulin levels can cause skin cells to multiply too fast, creating these thickened, darkened areas. It's a clear external sign of the battle happening inside your body. Section 3. Unique signs in men, women, and children. Diabetes doesn't always play by the same rules for everyone. Certain signs can show up differently depending on who you are. For men, a big one that doesn't get talked about enough is erectile dysfunction, ED. Studies show that men with diabetes are far more likely to experience ED, often at a younger age. High blood sugar damages the small nerves and blood vessels needed to get and maintain an erection. Another sign can be recurrent genital yeast infections, as the extra sugar in urine creates an environment where yeast can thrive. For women, as we mentioned, frequent vaginal yeast infections and UTIs are a major red flag. Conditions like polycystic ovary syndrome, PCOS, a known risk factor for type 2 diabetes, can also present with symptoms like acne and excess hair growth, which are linked to how insulin affects hormone production. For children, catching the signs is critical, as type 1 diabetes can develop incredibly fast. Parents should watch for the 4 T's: toilet, frequent urination, or a potty-trained child suddenly having accidents; thirsty, unquenchable thirst; tired, unusual lethargy; and thinner, unexplained weight loss. Other signs can include mood, swings, irritability, and even a fruity smell on their breath. That fruity breath is a sign of a dangerous condition called diabetic ketoacidosis and requires immediate medical attention. Section 4. The solution and your call to action. If any of this is ringing a bell, the first thing to do is take a deep breath. Don't panic and don't self-diagnose. These signs are clues, not a confirmation. Your very next step should be to talk to a doctor. A simple blood test is all it takes to know for sure. Your doctor will likely use a fasting plasma glucose test or an A1C test, which shows your average blood sugar over the last 2 to 3 months. An A1C level below 5.7% is normal. 5.7% to 6.4% indicates prediabetes, and 6.5% or higher on 2 separate tests confirms diabetes. Finding out you have prediabetes can feel scary, but it's actually an opportunity. More than 80% of people with prediabetes don't even know they have it. This is your body's final warning, and with decisive action, you can often prevent or delay it from turning into full-blown type 2 diabetes. Research shows that lifestyle changes are incredibly powerful. Losing just 5 to 7% of your body weight, that's only 10 to 14 pounds for a 200-pound person, can dramatically lower your risk. Aiming for at least 150 minutes of moderate activity a week, like a brisk 30-minute walk 5 days a week, is another game changer. Finally, cleaning up your diet by cutting back on sugary drinks and refined carbs while loading up on veggies, lean protein, and whole grains can make all the difference. Your body is constantly communicating with you. That fatigue you blame on, stress, that thirst you chalk up to the weather, that blurry vision you think is just aging, these could all be whispers. Whispers of a condition that, if you listen closely, can be managed and controlled. This isn't about scaring you. It's about empowering you with knowledge. Knowledge is the first step toward taking control of your health. So listen to your body. Don't brush off its subtle signals. Go schedule that checkup you've been putting off. Your future self will thank you for paying attention to the whispers, long before they ever had to become screams.